looked into the mirror, I saw a string-like object. It was moving around in a serpentine motion.
He said, Israel, you have a worm in your eye. We need to go to the hospital now.
25-year-old Israel Oriana lives in Oakland, California.
As I actually looked down and realized my leg was itching, I saw these weird bumps.
There are a lot of reasons why your leg could itch. Anything from the simple, like a contact dermatitis, to folliculitis, which is an infection of the hair follicles, to some of the things that you really don't want, like scabies and even bed bugs. Now this show is called Monsters Inside Me, so I don't think it's a contact dermatitis. Let's find out a little bit more.
They were warm in temperature. I figured maybe I had an allergic reaction to something I'd eaten.
Israel doesn't give the matter further thought until 5 months later.
5 months later, so a lot of things that I just mentioned don't go away and then come back 5 months later. Things like contact dermatitis, it shouldn't necessarily come back 5 months later. The bad things, scabies and bed bugs, those don't go away and come back. They just get worse and worse. So if it's not that, what could this be?
I realized that the bumps that I found on my legs were actually on my stomach and my abdomen.
Okay, so now those bumps have gone elsewhere to his stomach and his abdomen. Once again, you can get this with scabies and bed bugs and stuff like that, but I mean, this show is called Monsters Inside Me, so this is some type of monster, and scabies and bed bugs, they're pretty bad, but I wouldn't call them monsters.
The bumps were probably about the size of maybe an egg, oval in shape, and they were actually raised up from the skin. They were hot and itchy.
The size of an egg? This is nothing that we have talked about before. So what can create a mass the size of an egg? Lipomas can do that. I mean, I suppose you could have some type of a cyst, but usually cysts like epidermal occlusion cysts, those are much, much smaller. So this is something really bad and something really unusual, and we have to get to the bottom of this.
But I didn't think it was a big deal, so I didn't tell anyone, didn't tell my friends, I just let it be.
You've got egg-sized masses on your abdomen and you think it's no big deal and you don't tell anybody? This guy needs to see a doctor stat.
All of a sudden, I felt an itch in my right eye. It felt like something was in there. It got painful. It began to be unbearable.
So what are some causes of eye pain now? Well, you can get conjunctivitis. You could get a corneal abrasion. That's a scratch on the cornea. That could be really, really painful. A foreign object in the eye can also cause a lot of pain if you get something in it, like a fleck of sand or something. But we know it's not a conjunctivitis. We know that this is a monster.
I looked into his eye and I could see that there was irritation. I just couldn't believe what I was seeing. What I thought was a vein, it started moving.
There is seriously something moving in his eye. And this means that he has some type of a parasite of his eye. This is not my field. I mean, I'm a plastic surgeon, but there are certain parasites that I've heard of. There's toxoplasmosis that can actually go to the eye. There's a river blindness type of a parasite, and there's the Loa Loa worm as well. And we will find out hopefully exactly what this is, but this is definitely scary and I'm all for it. Let's find out.
I looked into the mirror, I saw a string-like object. It was moving around in a serpentine motion.
He said, Israel, you have a worm in your eye. We need to go to the hospital now.
He has a freaking worm in his eye. This is not like an earthworm in your eye. This is some type of parasite. And yes, the decision to go to the hospital is the right one. You got to find out what the heck is moving inside his eyeball. And I hope we get to see a picture of this.
I had the worm-like object in my eyeball earlier, and now when I need to show it to them, it's not there.
Isn't that always the case when you go see a doctor? Is you've got a symptom, you get there, and now your symptom is better. In this case, he has a worm that's living in his eye. It's possible, like a contact lens that moves into the back towards the back of your eyeball that you lose for a while. It's possible this worm could kind of slither underneath the conjunctiva, which is a covering of the eyeball, and move to other places. That is really, really freaky when you think about it, but there are parasites that actually do that. Now, I don't think that this parasite is in the actual vitreous of the eye. That's the gel-like substance that makes up the inside of the eye. Usually when you have parasites, it lives underneath the conjunctiva or possibly the sclera, which is the white part of the eye as well. Are you like the millions of people who have a bathroom filled with half-empty bottles and tubes of skincare? They may have promised to reduce your wrinkles, lighten your blemishes, and help you feel better about your skin, but none of them actually worked. Well, I've got the answer for you. It's called Youn Beauty. Youn Beauty is one of the only skincare lines that combines natural and organic ingredients with the latest and scientifically proven components like vitamin C and retinol. I'm so certain that you'll love Youn Beauty products that we offer a 30-day money-back guarantee, no questions asked. Head to younbeauty.com and use the coupon code 20OFF to get $20 off your first order over $99. I'll put a link in the caption below. Once you try Youn Beauty products, I bet you'll throw away your other skincare products and start loving your skin again. Thank you for putting your trust in me.
When we looked in Israel's eye, we were all stunned. It was moving. There's a worm in your eye.
And this unholy revelation could have serious consequences.
Did you see that? That is an actual worm in his eye. Is this like seriously the freakiest thing that you've ever seen?
Well, where did it come from in the first place?
I have been in medical practice, now private practice, for over 18 years, and I did 6 years of training before that, and I've never seen a worm in an eyeball. If I seriously saw this in my patient, I would probably pee my pants. I would seriously pee my pants. If I saw this in my own eyeball, I would probably poop my pants too.
The doctor then asked if I'd ever been out of the country, which I responded yes. West Africa? I said yes, actually a couple of years ago.
That indeed is one of the places that you can find a loa infection.
So he has the loa worm, and this is a relatively common type of parasite in West Africa. It's transmitted actually by deer flies, where the larva grows inside of a deer fly, it bites you, and it deposits the larva of the worm underneath your skin. Then that loa worm can actually grow underneath your skin and move to different parts of your body, including your eye. This worm literally slithers underneath the surface of your skin, going to different body parts, believe it or not.
The loa parasite is a roundworm that lives between layers of connective tissue under the skin and even burrows in the eye.
Now, the loa worm can live up to 10 to 15 years in its host, and it lays eggs, and those eggs can then deposit underneath the surface of your skin. Now, the good thing about the loa worm is, unlike, let's say, the river blindness parasite, it doesn't cause you to go blind, but it can create a lot of discomfort, as like what he had. It can cause some vision issues, but usually you don't go blind from it, at least.
For 2 years, the loa parasite creeps through Israel's skin tissue and feeds on his body fluids, leading to the bumps on his legs and abdomen, known as calabar swellings.
So those egg-sized masses are called calabar swellings or calabar masses that he had before. Now, the way you diagnose a loa worm infection is that you find a lump like that, you biopsy it and look at it under a microscope, and so hopefully you'll end up seeing either the worm or its larva underneath the microscope.
Dr. Wills puts Israel on a specialized course of antiparasitic medication called diethylcarbamazine.
The nice thing about a loa worm infection is that it can be treated with an oral medication like this. You don't have to have surgery or IV medications. Just this pill can help. It's also the same pill that is used if you travel, let's say, to West Africa as prophylaxis to prevent you from getting the infection. Other things that you can do to protect yourself is to use an insect repellent like DEET on your skin, and to wear long sleeve and long pants and long socks in order to prevent yourself from getting bit by these deer flies.
I was glad to say that I was well and parasite-free. I don't know exactly what happened to this parasite, but I know that it died somewhere inside me.
Well, that's a happy ending of the story. The good thing is he didn't have any type of lasting damage from this parasite. It probably just freaked him out. I know it wouldn't me to see this in your actual eye. Well, this one definitely gave me the heebie-jeebies, because one thing I don't like treating, honestly, are eyeballs. That just freaks me out. The other thing that I really don't like treating are feet. And of course, I reacted to an episode of My Feet Are Killing Me where a guy had not cut his toenails for like years. I mean, his feet were in a shape that you have probably never seen before. It will shock you. Take a peek at the video right up here where I react to My Feet Are Killing Me. And remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.